we as a country face a significant burden of neglected tropical diseases in Kenya, including lymphatic filariasis, schistosomiasis, trachoma, with over 25 million at risk of infection.
I'm happy that today we are launching a community-wide deworming campaign targeting intestinal worms, Bilharzia, and I encourage everyone to participate in this exercise.
In this county and in this region, Amref is privileged to be doing significant work around neglected tropical diseases. You have seen the deworming around TB and malaria, and I really would like to appreciate Ed Fund, who will be speaking shortly.
Today we are also here to another significant milestone, the launch of the mass drug administration against schistosomiasis and soil-transmitted helminths.
So in Western Kenya, under the Deworming Innovation Fund, we are supporting the interruption of transmission of intestinal worms and Bilharzia in 4 counties. Since 2021-2022, we have been supporting the National NTD program in the Western Kenya counties to undertake community-wide mass drug administration in order to significantly reduce the prevalence levels of intestinal worms and Bilharzia to a point where it is below 2% threshold.
Currently, we are in Western and we are conducting mass drug administration for the 2 diseases. That is basically administering 2 drugs. That is albendazole or mebendazole for intestinal worms and praziquantel for schistosomiasis. And this is administered across 142 wards that are endemic for intestinal worms in the 4 counties, and 40 wards that are also endemic for schistosomiasis.
Kwa majina anajulikana kama Gentrix Mtunguti. Niko na miaka 29 kutoka Mskoma Ward Village na Masanda A. Leo nimetembelewa na watu wa afya, nimepewa dawa ya minyoo na Bilharzia.
Part of the important steps in conducting MDA is to have what we call the macro planning at the national level, where we are able to plan for the exercise. We get the numbers right. That is the target population that we intend to go and treat. We also get the quantification of the drugs that we intend to go and supply to the counties for purposes of treatment. After we've done that at the national level, we still move to the counties to have the advocacy meeting to sensitize the counties, as well as also have the trainings in counties and also align with the counties in terms of the quantification that we've done at national, because remember, this particular activity is being conducted in counties and counties have to own the process.
So we are living in a changing world where even if you had the infrastructure, you need to improve on the availability of the equipment that you have for correct diagnosis and also care of the conditions that you are addressing.
Naitwa Shamim Nyangala Mohamed, CHV wa Navaholo Municipality Area, nikiwa chini ya CU ya Nambacha. Leo hii tuko kwa training ya magonjwa ya tegemezi ambayo imekuja Bilharzia na minyoo kwa kanisa ya Nambacha Friends Church. Ni siku 3 ambayo tumehamasishwa, tukumbushwe na ingine tuelimishwe jinsi tutakavyoenda kufanya hii campaign mashinani tukitumia simu zetu tuliozipewa through itches. Kuna app ya itches ambayo huwa tunatumia kwa field, ambayo tukienda household turegister watu wetu wote kwa hiyo household. So ukiklik to itches inakupatia all your household members na household zako zenye inafaa utembelee. Tumefurahia because walisema kwamba sasa pepe wakitoke, nikitaka kwenda kwa nyumba kwa ajili hiyo kupeana madawa, nitaenda kwa people, then nichague kama nimefika kwa John, ni click John, nikiwa kwa hiyo nyumba yake, nisemezane na yeye kwa ufupi, then nianze kumpatia huduma. Na huduma hii yote nitapeana ndani ya simu ambayo inaitwa hiyo app ya kwamba itches. Mara hii sitaandika kwa kitabu.
So when this is done, there's also shipment of drugs from Nairobi, the logistical part. the supply chain is also equally important, because if we get the supply chain wrong, then it can put the entire process in disarray. So basically, once we have those drugs shipped to the counties equally take up in terms of distributing them to the sub-counties to the wards, and the wards to the peripheral facilities where now the CHPs are given those drugs. And before this, we also have what we call the launch of the activity, so that it creates awareness as just a step to couple up with the other sensitization and social mobilization activities that are ongoing. And then we proceed to the relay treatment. Of course, the treatment is now conducted by the community drug distributors in Kenya. We call them the community health promoters, the CHPs, that distribute those drugs in two fronts. One at household level, moving from one household to another household. Of course, each CHP is given a specific area that they are able to treat. And then the other aspect is for the CHPs also to treat in fixed points like market, like churches, like schools, so that we reach each and everybody. And those particular CDDs are normally manned by their supervisors, who are health workers within the community. And when this is happening, we monitor the drug supplies, as well as we also monitoring any adverse reactions that are reported within the community.
Sasa hii dawa ukishaingia kwa nyumba na umesharejesta kila mtu, utapea kila mtu hiyo dawa, ama na sheria gani nyingine ya kusema huyu utampea na huyu usimpe?
Nitapea kila mtu, ila tu kuna wale wajawazito na hawa anachi alafu na breastfeeding, na wengine wanakataa, na tena kuna wengine wako kwa dawa za TB.
After the treatment has been completed, we do what we call reverse cascade. Basically, it means getting any drugs that have not been utilized within the communities back to the sub-counties and to the counties, and then back to the national level.
Dawa zikibaki unapeleka wapi?
Narutisha kwa chuo wangu.
So the drugs are basically donations from WHO through, or rather, donations from pharma companies, like the mebendazole we use is from Johnson & Johnson. The praziquantel we use is from Merck, and these drugs are normally donated through WHO, and then WHO gives that to the countries for utilization. Basically, this is a primary function of the Ministry of Health. So Amref is just supporting the Ministry of Health to carry out this particular activity.
We've made also quite progress in terms of stabilizing the transmission for soil-transmitted helminths as well as schistosomiasis.
Sasa ukisoma sira 38 maandiko kuna kichwa cha somo kitokezi kinasema ya kwamba tawa na ukonjwa, na mstari wa kwanza unasema mupe daktari heshima anayostahili. Bwana aliumba dawa zote kutoka ardhini, na mtu mwenye busara hawezi kusidharau. Sasa mimi nikisema labda dawa wasitumie, nitakuwa nimedharau kazi ya Mungu.
For the counties is basically for them to start now focusing on mainstreaming entities within the existing health system, and making sure that it's part of the integral part of the health service delivery within the counties. And this basically we have been working closely with the counties, and they have been allocating budgets.